Hi, I'm Tracy Lee Abrams, and I'm a family physician currently working in the Khayelitsha Eastern substructure. Sure, there's so many reasons why I love family medicine and why it's the best discipline to work in. I'm just going to mention a few of the top reasons that I love about it. So I love that I get to fulfill different roles. As a family physician, I get to be a clinician seeing patients with a whole range of different medical conditions. I love that I get to be a consultant, being a support to junior staff and to nursing staff. I love that I get to be a champion of clinical governance, improving systems and improving the patient experience. I get to be a supervisor, a mentor, a teacher. These are all some of the roles that a family physician fulfills. I love that it never gets boring. We see a whole range of medical conditions, surgical conditions, patients from different ages, from different walks of life, and one never becomes complacent with a specific set of illnesses. I love that I'm able to work anywhere, anytime, in any department. And I love that family medicine keeps me on my toes with all the new updates in guidelines. We have to stay on top of our game and continuously improve ourselves to be able to provide the best care we can for our patients. I love family medicine for my colleagues, my fellow family physicians who are laid-back people with not so serious outlook on life, always having each other's backs and looking out for each other. I love family medicine for the patients, getting to know individuals, walking a journey with them, getting to know them as a family person, as a career person, as a friend, as a community member, and not just focusing on the illness. I love that family medicine introduces me to a community, to the community I work in, being able to get to know the community as if it's a person, getting to know what the common medical conditions are, what the prevalent violence issues or the prevalent issues in the community is, forming part of the community, of the togetherness, of the sort of commonality, and being embraced by the community after working in a specific community for a while. And I love that while I was a postgraduate student learning about family medicine, I was taught a different way of thinking about things. I was taught a different approach to the patient. I was taught that being patient-centered and practicing shared decision medical practice, that was the norm, and that should actually be the norm throughout. I learned about reflective listening. I learned about seeing the patient not just as an illness, but as an individual. And I think I've learned to be respectful towards a patient. I've learned about self-awareness. I've learned about promoting health in myself, in the patient, in the community. And I think family medicine is not just a discipline, it actually becomes a way of living. A lot of the principles we learn can be applied in real life. So I think what I mostly love about family medicine is that it helped me to become a better version of myself.